first Thursday thoughts for 2024. Hope everybody had a great holiday and New Year. Today we're going to be talking about a kind of interesting deformity of the breast that we treat in a more reconstructive fashion than just purely aesthetic surgery. So we're going to be talking about tuberous breast deformity. And it's a little bit more common than people may realize. I have patients that come in that may not even realize they have this deformity because it can present in multiple different stages of severity. But it makes the procedure to get them a great breast augmentation or improve the shape of their breast a little bit more challenging than just a traditional breast augmentation or a breast lift. So we'll get into the anatomy of what causes this and what we can do to help fix this during surgery. So first of all, let's talk about kind of what a normal breast is. So we have a picture here of a normal breast with the parenchymal and glandular tissue of the breast dispersed throughout the breast. And so as we go through puberty, all this glandular tissue of the breast is closer to the nipple areolar complex. And in the tubular breast deformity, what happens is that glandular breast tissue where we actually make milk when we're breastfeeding gets stuck in the nipple areolar complex and it becomes herniated in there and it becomes constricted. So this is what the tuberous breast looks like. So anatomically, what does that look like from the outside? You have this very puffy nipple areolar complex where the majority of the breast tissue is never really migrated out of that area. And so you have ptosis or hanging with a droopy nipple and much smaller skin envelope in the more severe cases. So here's kind of a grading of the tuberous breast deformity. It comes in 3 grades basically. Type 1, where a patient may not even realize it, and this is where some of our patients come in and they didn't even know they actually have this problem, but us as plastic surgeons recognize this and know that to get a good result where they don't have different types of deformity after getting a breast augmentation, we have to address this surgically. And then the most severe is this type 3, where again, as you can kind of see over here, all that breast tissue is in the nipple areolar complex. There's a skin deficiency. The distance from the nipple to the inframammary fold is much smaller, so it may require multiple surgeries to get the best result for these patients. I'm going to be going over a patient I had recently. She had basically a grade 1 tuberous breast on the right side and kind of between a grade 1 or 2 on the left side. And you can kind of see the edits that we have to do to make sure this doesn't get flagged on social media. Makes it a little hard to see, but this triangle does kind of depict that nipple areolar complex where it's much more puffy and a lot of that tissue is in there. And you can also see how the distance from the nipple to the fold is very short, especially on the left side. So here's my pre-surgical markings where I'm actually going to drop the fold to make the incision lower so we can expand that lower area with the implant. We also have to do something that's called radial scoring to release that breast tissue to allow room to expand that with an implant. If we didn't do that, you would end up what's called a double bubble deformity where you would see the outline of the implant and then this little pile of breast on top of it, and it's just not aesthetically pleasing. The other thing that we have to do to address this in patients is often do some type of lift. In this patient, she was a good candidate for a peri-areolar lift, or a donut lift, where we take out this rim of tissue between the areola and the rest of the breast to shrink down the nipple areolar complex and flatten it out so it's not as puffy as it was. And then here's some post-op pictures. She actually did really well, and you can see we dropped the fold on both sides, but more dramatically on the left side, and that incision's hiding right in there. This patient, these photos are only 5 weeks after surgery. The implants are going to continue to settle and get a more natural result. But another one of the things that we can't do for a patient with a tuberous breast deformity is put a very large or a high profile implant. You have to start with a smaller implant after we expand that skin envelope. She might be a candidate for getting a larger breast augmentation in the future, but we have to start with what is reasonable to begin with to get the space that we need. Then you can appreciate it quite a bit more on this side view. Again, the edit makes it hard to see, but her nipple areolar complex really is that pointy with the tuberous breast deformity. And after doing the augmentation and the periareolar lift, it flattened it out much more, making a much more normal and aesthetically pleasing breast. Do we have any questions on this subject?
Well, yes. The first question is on TikTok. And do you know the cause of severe asymmetry? What's the cause?
The cause of asymmetry, it's just developmental, it can be hormonal, but most people have asymmetry in multiple parts of their bodies, but the breast is especially one of those areas. Very infrequently do I have a patient that has like imperceivable asymmetry of the breast. And a lot of patients actually have quite a bit more asymmetry than you typically think about. And we're able to address a lot of that with surgery. But again, we always tell patients you have asymmetry before surgery, we're going to improve it and make it as good as we can, but you'll always have slight asymmetries after surgery as well.
Would you accept a patient with a BMI of 34.5?
My BMI cutoff is 34. I think you can lose those 2 pounds to get down to that 34 mark. But if it's really a difference of 0.5, sometimes we can bend the rules depending on your distribution of body weight. All right, thank you everybody. I hope you have a great beginning of the year, and we'll tune in next week.